Okay, good afternoon, everyone, and welcome to the Firefighter Cancer Initiative's monthly seminar series. I'm Alberto. We'll wait just a couple of minutes or two to allow participants to fill in our virtual home today. So as you get settled in, make sure you have your audio settings set up correctly. In just a minute or so, we'll go ahead and begin by introducing our speaker. So just bear with us 1 minute as we give some time for folks to fill into the room. Thank you. Okay, so I'm seeing a nice plateau of our participants in for this afternoon. So in the interest of time, I'll go ahead and get started. So my name is Alberto Caban Martinez, and I'm joined today with my colleagues from the Firefighter Cancer Initiative, Tara Greenberg, our new project manager for FCI, as well as Dr. Natasha Schaefer-Sally, our deputy director for FCI, and Simi Oruwale, our research associate. Together, we are really excited to present to you the first seminar series for 2022 with our senior investigator, professor and chairman of public health sciences, Dr. David Lee. I'm going to take a privilege for a second in introducing him, embarrass him. Not that because he's old, but because I've known Dr. Lee now for over 20 years, and he trained me when I was a medical student and a graduate student. So there is light at the end of the tunnel for the trainees that are joining with us in the seminar series. And one thing he always taught me is, be persistent in your science, because it always comes back, to help you and help the communities that we serve. And he started originally with firefighters here at the University of Miami just a couple of years ago. And in the last 7, we've been able, thankfully, to keep him involved and engaged as he provides guidance for the overall scientific agenda for FCI, as well as leading our very unique and important firefighter cancer registry. We're in for a very special treat today because the topic is understanding multiple primary cancers in firefighters. And so we often get, when we're in the field, these questions about, well, is it possible to get more than one cancer? Right? You normally, if a firefighter does develop cancer, is it possible to have more than one? And today we'll start delving into that question through the opportunity of using our firefighter cancer registry. So if you will indulge us for a couple of minutes, Dr. Lee has some slides he wants to share with us as we walk through that individual topic, and reserve your questions to the very end. You'll notice there's a chat function here in the seminar room, so feel free to pop those in. Somebody from the FCI team will be posing those questions to Dr. Lee, or at the end of the session, you're also welcome to unmute yourself and ask any questions as there. So without further ado, please join me in giving a virtual round of applause to Dr. David Lee, who will be talking to us today on multiple primary cancers among Florida male career firefighters. The floor is all yours, Dr. Lee, and thank you.
Thanks so much, Alberto. That was a very, very kind introduction. And yes, I was recruited to the University of Miami more than 30 years ago, specifically to work with firefighters in the state of Florida, and so it's a privilege and an honor that we're able to continue this work in this current century. So I'm going to share my screen, and can I get a thumbs up as to whether or not people can see that? Got it? Okay, excellent. All right. So as Alberto said, I want to share with you some work that we're doing on multiple primary cancers and the risk of that in our male career firefighting population here in Florida. So we know from our own research and research conducted worldwide that firefighters are at increased risk for select cancers. And in part because of advances in cancer screening, earlier detection, and enhanced lifespans of many cancer survivors, what we're seeing nationally, irrespective of occupation, is a greater opportunity to go on to develop a second cancer or even a third and fourth cancer after a person is initially diagnosed with a cancer, either in childhood or in adulthood. And so we refer to that in the literature as multiple primary cancers. So that would refer to that second, third, or fourth that is not a metastasis of the original cancer, but is a distinct new cancer that often occurs in different parts, different part of the body when it, as opposed to the initial primary cancer. So unfortunately, we know very, very little about the risk of multiple primary cancers among firefighters. However, we did learn through the unfortunate experience of the World Trade Center disaster that that not only were the firefighters who were responders and worked the pile have an increased risk of cancer, of a primary cancer, they also were shown to have an increased risk of multiple primary cancers. And what is interesting to note here is that the risk of both the primary and multiple primary cancers was about 30% elevated in the firefighters. And so this is a very uniquely exposed group. Here we have just one photo of firefighters working the pile, and as you can see, most of them were not wearing SCBA. There was unfortunately an underappreciation of the risks that were present in the off-gassing of the pile at the time. And so there was some, in many cases, some rather large sustained exposures in this particular cohort. And so we can see, the unfortunate aftermath of that is a documented increased risk of both first cancer and then multiple primary cancers. But aside from that study, there's basically nothing is known about the risk of multiple primaries in firefighters. And so that's what we have been focusing on. And we hope to, and we have documented the, whether or not firefighters are in fact at increased risk. But more importantly, because of the size of our linkage, we were able to actually look at the patterns and the types of second, third, and fourth cancers that firefighters were experiencing, and comparing that to the general Florida population to see if to really take a deeper dive into what specific cancer risks firefighters may face as these second, third, and fourth cancers. So just a reminder for those attending the seminar that the project that I lead, the Cancer Registry Project, is just one of many projects here with FCI that is focused on prevention, education, screening, and other and monitoring for cancer risk. So the data that I'm going to be presenting to you today comes from our original linkage. And I should mention that we had done this linkage more than 15 years ago when I was, I did not possess any gray hairs. And we had the opportunity through the FCI funding to repeat that linkage. And we basically took certification records from the Florida State Fire Marshal's office. At that point, it was about 110,000 records that included certifications for career firefighters as well as volunteer firefighters. We linked that to our cancer registry database, which now contains over 3.3 million cancer records because we've been collecting cancer registry data since 1981. And we were able to identify firefighters who had developed cancers. And in our initial paper, we were focusing exclusively on primary, that first cancer in firefighters. And we had identified in our linkage about 3,700 male career firefighters with a primary cancer and 168 primary cancers in females. And the question about cancer risk in female firefighters is very much an open one because historically the workforce has been predominantly male. So we know very little about cancer risk in female firefighters. But our analysis for primary cancers in career firefighters allowed us to really look at cancer risk among the women. But today I'm only going to be presenting results for male career firefighters. And the reason for that is that the number of multiple primary cancers among the female firefighters in Florida was really too small to do any meaningful analysis on. So before moving on to our findings for multiple primary cancers, I wanted to give you a quick snapshot of what we found with respect to primary cancer, that first cancer in male career firefighters. And these were the 4 sites that were elevated in Florida: melanoma, prostate, testicular, and thyroid cancer. And on the right-hand side here is a risk estimate. This tells us 2 things. If this line right here does not cross 1, that means the elevation in risk that is reported by the dot is statistically significant and statistically higher. And the dot itself tells us the degree of risk. And so for melanoma, for example, the firefighters had a 56% increased odds of having been diagnosed with this cancer, 36% for prostate, 66% for testicular, and a very large, more than 2-fold increased risk of thyroid cancer. And our team is doing a deep dive on this elevation in thyroid cancer risk, which is really the highest reported out there among all of the previous studies that have been conducted in this area. So we can come back at another time and share some of those findings with the group. All right, so here's what we did. We took our linked data set, pulled out the male career firefighters diagnosed with cancer. The comparison group here are non-firefighters, also in Florida, who have been diagnosed with cancer, other than the cancer of interest. And for those statisticians, few statisticians on the call here, we calculated incidence relative risks for each cancer site. And we did it for the top 10 multiple primary cancer types, both for firefighters and non-firefighters. So we could kind of get a comparison of the relative ranking of different 2nd, 3rd, and 4th cancers. And so here's the basic descriptive data on the proportion of firefighters who had, in our linked study, just a single cancer. It was 80%. And then we had about 16-17% of firefighters had a second cancer or first multiple primary. And you can see it becomes exceedingly rare. It becomes exceedingly rare to have second and third multiple primaries, but as you can see, it does in fact happen. And this is the distribution here for Florida in general. And what we find is just a slightly higher risk of having this second and third multiple primary cancer. And when we apply a statistical test to this, what we see is that firefighters have about a 14% greater odds of having multiple, more than one, or falling, more than one, more than two, more than three multiple primaries relative to the general population. Now, the two things to say about this, one is that this effect size is small, and it is barely statistically significant because this number has to fall above 1 in order to be statistically significant, and it is right on the borderline. So this is while it's technically a statistically significant finding, we have to be extraordinarily cautious about how to interpret this. So cannot conclude with great certainty that firefighters in fact do have an increased risk of multiple primaries, at least in Florida. What is more interesting, however, when we dug a bit deeper, is to look at the specific cancers that occurred at that first primary, second, and third. And so this sequence number is reflecting the fact that those within this category had a primary cancer and then a second. This category here had a primary, second, and a third, and so on. So what we've done here, we were just looking at specific cancer sites. And we also looked at some broader cancer groupings and looked at the 10 most common second, third, and fourth cancers. And we rank ordered these based on our firefighters. And so if we just go down this list here, the most common second or first primary, so they had a primary and then another cancer. The most common cancer that occurred was prostate cancer. And then following that, digestive, then all forms of melanoma, melanoma specific to the skin, and so on. And so this percentage here tells us that within each category, so here now we're just talking about the firefighters who had a primary cancer and then they had another cancer. So their first primary cancer. Here is the distribution of what those cancers were among the firefighters. So as you go down the list, because we rank ordered them, of course, that number is going to go down. And for comparison purposes, we did the same thing for all of the non-firefighter cases, multiple primary cases in the state of Florida. So what is this telling us? Well, first of all, we have the observation that if a firefighter who's had cancer is going to get another cancer, the most likely cancer that would be is a prostate cancer. But how does that compare to the general population? Well, as you can see here, that in the general Florida population, prostate cancer is, again, the most common cancer because it's the largest percentage in this column, but it's actually higher in the general population. So I won't go into all of this, but I want to point out a couple of patterns here that we think are important. And that is melanoma of the skin. Because if you can see here, because this list is rank ordered by what we saw in the firefighters, we can sort of compare this relative ranking over here by looking at the percentages that you see in these cells. So for firefighters, if they had an initial cancer and then a second one, that second cancer occurred 12% of the time. It was melanoma of the skin. But if you look over here, among the general population, it's only 6.7, so roughly about half the proportion of the total second cancers here that we're looking at. And we think that this is significant. This is really noteworthy because we can show it better with the next slide here. And this is where we took some, we did some statistical modeling, and we compared that experience of the relative risk of having a multiple primary and compared that to the general Florida population. And one of the things that really just stands out here is that melanoma of the skin for firefighters is almost about twice as likely to be seen as the second, third, and fourth cancers in firefighters relative to the general population. So it's across the board here. And this asterisk means that this comparison is statistically significant. Now, I want to go back to the findings from the initial paper where we were looking at just the primary cancers. And I showed you 4 that were elevated in Florida firefighters, and now I'm just showing you those primary results here for 2 of those cancers. And for the firefighters, for having a first cancer, their primary cancer, the risk of that was 56% greater in firefighters than non-firefighters. And I think that that is really significant because then we see this consistent elevation in risk across the board. So firefighters are at increased risk of having the melanoma as a second, third, and fourth cancer. So there's a pattern here. And this statistical testing that we did also goes in 2 directions. So anytime this estimate here is below 1, that means that in this case, firefighters have a lower risk of having that particular type of cancer relative to all Floridians. And I want to point out that the only statistically significant reduced risk of having a second cancer for firefighters was found for prostate cancer. So even though we found an increased risk of prostate cancer in firefighters, they have a lower risk of having, if they have a second cancer, having that be prostate cancer. And I cannot tell you why we found that association, because it seems like it conflicts. But in my view, what it also does is points us back to the consistent elevation that we see here, that across the board for melanoma of the skin in firefighters. So I think that this is a real concern that we have identified in terms of multiple primary cancer risk in Florida firefighters, that this consistent elevation in risk of melanoma of the skin. So I want to pause for a second. I just have one slide on this. This is another study that we have been working on, but it takes a different approach, and we just basically used our linked data file to pull out primary melanoma cases. And in this case, we were interested in both career and volunteer firefighters, because if you recall, we had certification records on volunteers as well. So this was our first look at the cancer risk in our volunteer firefighters in the state of Florida. And we were particularly interested in sort of drilling down on this risk of melanoma in firefighters. And so we did a number of analyses, and I just wanted to highlight a couple of primary findings here. So starting first with the career firefighters, and again, we're talking about primary cancers now. Career firefighters were at significantly greater risk of ultraviolet light related melanomas, because this is based on a histological subtype of the melanoma diagnosis. And we found that career firefighters were at increased risk of having both UV related and non-UV related melanoma. And when we think about UV related melanomas, we can think about a number of hypotheses. One, of course, is that firefighters are more sun exposed on average than the general population, both as a function of their occupation, but also that they may just be more outdoor types. They're out in the sun more. They're engaged in hobbies that takes them outside, and so there may be a personal risk there and an occupational risk. And so we see that for UV-related melanoma, there is an elevation in risk for career firefighters. What we find, however, for the non-UV, we actually see a slightly increased, stronger association for the non-UV related melanomas in career firefighters. So that may be due to some of the, more due to the occupational exposures, the dermal exposures, the carcinogenic exposures that they have. Thermal, the fact that you're out there and you're working in bunker gear, you're sweating, the resorption of chemicals can be enhanced under those conditions. So more of a probably an occupational associated risk here when we're talking about the non-UV related melanomas. So we see that for the career firefighters. Well, what about the volunteers? Well, it turns out that we see an increased risk, but only for the UV related melanomas. And I have to caution everyone that even though this is a very strong association, this confidence interval, this is our 95% confidence interval, which says that we think the true estimate, whatever it is lies somewhere between 1.31 and 21.99. So we don't have a high degree of confidence, even though it's statistically significant. So again, we have to be somewhat careful here. And why is this happening? Well, we have, we just had fewer cases of melanoma. So in our volunteer firefighters, and so it's more difficult to really pull out any sort of signal from the data under those conditions. But nevertheless, we see an increased risk of UV-related melanoma in volunteers. And in my mind, this sort of makes sense because volunteer firefighters are not going to have the kinds of the degree of occupational exposures that career firefighters would have, just because there's just the sheer number of fires that career versus volunteers are responding to. Although, you have to counterbalance that by the fact that they have less protective gear sometimes when they are actually fighting fire. So it's really a complicated area for us. But nevertheless, we see just this increased risk for UV-related melanoma. So what we may have, again, is that volunteer firefighters, again, may be more active. We don't know what their primary job is. Are their primary jobs more likely to be a sun-exposed kind of a job, working outdoors primarily? We just don't know that. So this, I think, the findings from this study, I think, help to bolster some of our primary conclusions here, which are that we saw a slight increase in the risk of multiple primaries in Florida male career firefighters. More concerning for me is that we saw a consistent patterning of the type of second, third, and fourth cancers in male career firefighters, all focusing on melanoma, and basically leads to the question, it's like, why are we seeing what we're seeing? And we certainly do not have all the answers. But my primary thinking here is that we have unidentified and some combination of identified and unidentified occupational exposures that may be leading to this increased risk, not only for risk of primary melanoma, but also for multiple primary melanomas in firefighters. So we need to really, get busy and do that necessary research to better understand this. So I'll stop there and take any questions that people might have.
Awesome. Thank you, Dr. Lee. We do have a question here from Jason. He said, just wondering if the testicular cancer was in younger age, like it normally is in the general population. Curious on the average age, if you have it.
Yes, we did. We did some stratified analyses, I believe, in the original paper for younger versus older. I'm not sure if it ended up in the paper or not, or if we had it as a supplemental table. But I don't know off the top of my head, but we could certainly follow up and get an answer to you for that.
Okay, awesome. Thank you. Are there any other attendees who have questions? Oh, okay, another one popped up. This one is from Sean. What's the best test to diagnose those 4 cancers?
Ooh, we have screening recommendations for prostate, for testicular, for melanoma, with different grades of evidence about how strong those tests are. But certainly for prostate, we have the PSA test, which is a non-invasive blood test. That we should be monitoring PSA levels as we get older, and as those levels start to increase, that's a sign that there may be a follow-up needed for prostate cancer there. Monitoring our own skin and having annual skin examinations by a dermatologist is also something I would just flat out state that firefighters should be doing that based on the findings that we have that they are occupationally at increased risk for melanoma. So we covered prostate, we covered skin. And unfortunately, we don't have approved screening methods for all forms of cancer.
Awesome. Thank you, Dr. Lee. I believe that there is just another kind of blurb from Chief Matt. He also suggested the San Francisco Firefighter Cancer Prevention Foundation as a resource.
Excellent. I hope that they might possibly be in attendance at our upcoming symposium, so we can interact with them. Yes.
For sure. We do have another question. Sorry, I'm hitting you back to back with questions here. They're coming. Right. I'm trying to make sure we answer all of them. The next question is from Chris. He says, do you believe that the Gallery early detection blood test is a good tool for early identification?
Not familiar with it. There's a lot of kind of universal detection services being offered out there. That it is. I think we could probably devote an entire seminar to the topic. Because there's no easy answers for this. We have the what we call preventive services guidelines, and these are expert panels that look at all of the data and judge whether or not certain screening modalities should be applied at a population level. This is just general guidance for the entire population, not specific for high-risk occupations like firefighting. And those guidelines tend to be pretty conservative, and they are not only looking at the evidence that the particular type of screening modality actually captures cancer, in particular early stage cancer, accurately, but it also weighs the risks and the benefits of recommending that the population be screened for cancer X at age Y. And the reason why they have to do this cost benefit analysis is that if a particular screening modality, whatever it is, leads to a lot of false positives, leading to a tremendous amount of follow-up studies, some of which can be invasive, right, and can cause harm in and of themselves. And so they, and prostate cancer is a great example of this. So they weigh the costs and benefits of this very, very carefully before they would make a recommendation that the nation should be doing this. And this is really a challenge for firefighters. I would say that what we should be doing is following those guidelines and then making some and using the screening modalities that are recommended by the prevention services panels. But then I think we have to make some modifications to those specifically for firefighters. And I think melanoma is a great example of this, that we should probably be more aggressive in screening for melanoma, given what we have found in our studies. And there have been other studies that have shown there's an increased risk of melanoma in firefighters. There's a whole bunch of stuff out there that's being marketed, and some of it is even being marketed, I think, specifically to firefighters and other higher risk occupational groups. And so, it's really tough to make any sort of recommendations on those things because of the lack of information. Personally, if a company is marketing, a particular screening test to me and my family, I would want to know, okay, show me the independent research, that there's a benefit here. Don't show me the research that you've paid to do, but others have, and are the findings from that consistent? Oftentimes there's no there for some of these companies and what they're marketing. And that doesn't speak to the specific test that you were asking about, because I know nothing about it. So I don't want to imply that that's junk science, or that you shouldn't do it. But I would start with what the expert panels recommend for screening. And if that particular test doesn't fall under there, then I think it requires a bit more scrutiny about whether or not that's a good idea to go down that road. But if you do decide to do it, do keep in mind those potential harms. And the potential harms are basically, threefold. Actually, it's even more than that. So if the test is not accurate, it could miss a cancer that's present. You don't want that as an outcome. The bigger concern is where you have a test that is positive, but there really isn't cancer there. And then you have the anxiety, the cost, and potential harm for some of the procedures that you may have to undergo to rule out that suspicious mass is cancerous or not. So go in with eyes open when you're kind of contemplating whether or not you want to do one of those tests that are out there being offered by companies.
Awesome. Thank you, Dr. Lee. Great points. You know, it's definitely important to look at those tests very closely. Are there any other questions from our participants today? I don't see any in the chat. Please feel free to unmute yourself or ask your question in the Q&A box. We'll give
All
you.
right, so I don't think we have any other questions. So Dr. Lee, thank you so much for being here and presenting your great work. Thank you, everyone. We had a really great showing today. Over 55 people came. So thank you all for being here. We want to remind you that our National Firefighter Cancer Symposium is happening at the end of February, starting on the 24th. It is a hybrid model, so we will be in person at Lone Depot Park, so where the Miami Marlins play on Thursday and Friday. And it also will be held virtually. So if you're able to go on to our website, you can go to sylvester.org/NFCS and you can register. Registration is free and everything will be online for you. The other thing I wanted to mention is on the 26th of February, we will be having the Dolphins Challenge Cancer event where we will have a large firefighter team. So if you are a firefighter and you are interested in being a part of it, please email us your name and we will give you all the information for you to register and how we will cover your fundraising fees. So we have been very fortunate that we've gotten many donations and sponsorships to cover 100 firefighters. So first come, first serve, that we are covering 100 firefighters. So it's an amazing event. You guys have probably seen videos and pictures of firefighters in their turnout gear running the 5K. You've seen myself and Dr. Caban and Dr. Kovets pretending to be firefighters and, graciously wearing the gear that has been donated to us. But really a great event for family and friends and everyone to get together. So it's a nice way to end the symposium. If you have any questions about any of that, please feel free to reach out to us and we'd love to see all of you guys.
Great.
Thanks
Bye,
again.
everyone.
Have a good one.